This is Caribbean Medical TV, and today's episode is forged by the many viewers across the Caribbean. We return to the most asked about topics. We've carried you throughout the region, and now we're about to carry you through the body. We begin first with the anchor point. What does it actually mean to go to the doctor?
When patients come to you with their biggest health concern, it's a vulnerable moment for everybody. So everybody who comes, whatever, mannerism that they may have or whatever bias that they may have, you don't know because you don't know who they came from before. However, when they walk in, from the demeanor, the way they address you, where they sit, all of those things are science. And they even teach us that how open a patient is to you depends on how they sit. If they sit with their hands open, if they sit in the sit close to you, all of those things matter. It's a science-based profession, and it's kind of like applied science as well, because you have to do with the social aspect as well. So it's not just pure science, because I'm not just taking your symptoms and computing it and giving you a diagnosis. It's a lot more than that. There's also a huge social part that you have to try to blend in completely to give the product of, the healthcare.
I'm a human geneticist, which means I study the human genome. This is the most fundamental set of information about what makes us who we are. It is an entity that exists in every single one of our cells. And basically, we're trying to understand what that information means. The information in our genome can tell us about what diseases we were born being prone to. It can tell us about diseases that we may acquire later on in life. And we can also learn from the information in our genomes how we might respond to certain drugs. So for example, some people might have mutations that make their proteins unable to metabolize certain drugs. We really are starting to see how genetic medicine, genomic medicine is coming into the clinic to make things much more efficient and to make us more precise and personalized with the treatments that we give to our patients. We're actually seeing the emergence and the re-emergence of infectious agents that are now leading to epidemics and pandemics more frequently. So the same technology that we use to study human genomes is the same technology that we use to study the genomes of all of these pathogens. In fact, every organism on Earth has a genome, and the same technology is used to read it. So we can use this technology to study these pathogens and then use the information about their genomes to design therapies against those particular pathogens. So this is going to allow us to then react quicker to the emergence of infectious diseases as climate change occurs and continues to occur.
We are designs of a different making. We just heard about the vital biology and complex genomes that forge the building blocks of our very being. Now we explore the very life that courses through our veins.
Why am I testing my blood? And what's in my blood to be tested? And one has to always look at what is blood. Blood is a combination of what we call red blood cells, white blood cells, and you could say serum or other substances in them. The white blood cells would be your cells that respond to inflammation or aggressive attacks from bacteria, viruses, and stuff. And when you do a complete blood count, it measures the amount, the quantity, and to a certain extent, if you do some other tests, can give you an idea of the quality of it as well.
So have you ever been to the doctor before and you ask, hey doc, can I do a sugar test? Or the doctor has requested that from you and you wonder what exactly is that? But then they go on to take a blood sample. They're simply asking you to take a blood sample, send it to a testing lab like us, and then we can run multiple different types of blood sugar tests. So you can have a fasting glucose test, you can have an HbA1c, and multiple other things to look at your blood sugar. So simply, a lab is where we can look into what's really going on inside the body. Now, we're talking today from the Genetics Center for St. Augustine Medical Lab. That is now where we use molecular medicine techniques or simply DNA analysis techniques to make diagnosis that are more individualized and targeted towards certain therapies and treatments. Well, now we're speaking about preventative medicine, and next generation sequencing, especially through hereditary sequencing, would be one of those methods. It's where we consider preventative medicine now. That's why you would want to know. You want to know earlier. You want to know to screen earlier. You want to know if you have to take any preventative measures, proactive care. That's why it's important.
We're currently here at the Ezra Lung Laboratory, where we both function as a clinical and a pathological lab. The pathological lab in its entirety looks at body parts or organ systems and blood cells, and we try to identify different disease processes, or what you call pathologies, that can be either classed into infectious, cancerous, or non-cancerous entities. The blood tests or the lab tests that are done are meant to support the diagnosis, because there are so many disease processes that are very similar. There are so many diseases in the world, from skin to internally, if you think of any organ, the lung itself has so many processes. The liver, the intestines from small to large, the stomach. And lots of persons say 80% of diagnoses are reached using the lab.
My name is Vonetta George. I am a consultant general surgeon at the Sir Leicester Bird Medical Center and the present chief of surgery. I am one of 6 general surgeons who we have here. And the unique thing about a small island general surgeon is that you should be able to deal with any surgical emergency and many of the surgical issues that arise, meaning that you should be able to do some pediatric surgery, even some urology, orthopedic surgery, gynecology, anything in the surgical field, because you never know what you may encounter. Small island challenges right now, one of our biggest things is breast cancer and breast cancer awareness, breast cancer screening, treatment, and how do we take care of our patients right here in Antigua. I tell women, once you're 40 years old, I need to make sure that you're getting that yearly mammogram plus your ultrasound. I speak to men and I say, listen, you're 40 years old, that means we need to get your prostate checked, your prostate exams, your PSA, and you follow with your urologist. I tell persons, especially persons of Afro descendants, most people in our Caribbean here, if you're over 45, you need to start thinking about getting a colonoscopy, because the rates of colon cancer are higher in people of African descent. And then right now we're talking a lot in Antigua especially about cervical cancer elimination. And when we talk about that kind of elimination, we talk about, of course, vaccinating, remembering that it's related to HPV infection, and also screening, and that would mean pap smears. And it's recommended that the women get their pap smears every 3 years.
I'm a member of the Antigua Lions Club, and one of the things that we do annually is prostate screening for men. That started 16 years ago with about maybe 80 men, but over the years, it has grown. Where else can you find 900 men showing up for prostate screening? And it's a community. The same faces show up every year, they talk cricket, they talk football, and they wait patiently for the doctors to come. But this is them taking their health seriously. Some of them, their wives, their partners encourage them to come and come with them. But a lot of them, they hear the message. And we've seen a change in the demographic. It was a lot of older men initially, but now we're seeing younger and younger men. Men in their 40s are coming and joining with men in their 70s for prostate cancer screening, and they take it seriously. And many men have said to us, this is such a lifesaver because I didn't know what I was dealing with. And so the awareness is there.
Thanks to Desirée and all those helping to foster forums where people can come together to ask and inquire about their health. Awareness is now more critical than ever. Now a question from our viewers.
I do not like taking tablets at all. Why do I have to run a full course when the doc assigns it?
For this, we joined Dr. Nathalie Robinson in Dominica to share her insights.
One of the things that I do when I interview patients is that I talk to them about their medication taking behavior, you know. You have diabetes, you have high blood pressure, you know. Are you taking this? Are you taking that? And they'll say to me, doctor, you know, I don't take this every day. Or I only take this twice a day, even if it's 3 times a day. Or I take it once, or when I remember. And so I found it interesting that diseases are not really controlled, not necessarily because the medication is not prescribed, but because the persons are not taking them, you know. And there's a quote that says that medicines don't work in persons who don't take them. And bringing it right back home to my mom, who is actually a retired nurse. I mean, I would, you know, get her medication every month because we'd be prescribed medication. It would be dispensed for a month. So every month I would expect, you know, to get medication. And a month and a half and 2 months would pass, and I'm not hearing anything about medication has finished. I say, but mommy, you still have yes, I still have medication. So which means that she's doing the same as the patient. She's taking it, you know, when she feels like and when she remembers.
One of my concerns as a pharmacist, there are quite a few, but one in terms of drug management and understanding what the drug is, what it's for, how to take it. The other concern is we have a lot of patients that come in for acute treatment. So for example, the common cold, the flu, maybe an infection, a fever or something like that. The doctor gives antibiotics, for example, and he says, okay, well, you're going to use that antibiotic for the next 7 days, 3 days, 5 days, 7 days. The patient begins consuming the antibiotic, and after the first day they feel better, so they will stop the use of the antibiotic. Now that is very important, because what happens is once you've started taking the medication, you're now creating an environment within your system. And so if you stop taking the medication before the appointed time, then you can cause more harm to yourself than thinking that you're doing good because I'm feeling better, so I don't need to take until it's done. You understand? I always tell the patient when they come to the pharmacy, it's not bread. We're not selling bread where the bread is packaged. You know, you come and say, give me $5 bread or give me 2 bread or free bread. I just take it and I give you a bag and turn my back. And then sometimes some patients will say, but it's just that not taking so long. Okay, for me, explain what is that. I always ask them, please tell me what is that, because I don't get the concept about that. That could mean life or death, and you don't understand that. You understand? So when the pharmacist is taking the time to put the stuff for you, there's a lot of things we have to check, because we're the last line between you and your doctor. Once you take that script and you go home, that's it. When you get an allergic reaction or something happens, they have to rush to the doctor and try and find the doctor or try and find the pharmacist. Let us try and avoid that before.
This is Caribbean Medical TV. Stay tuned and we'll be right back with more.
Hello, I am Nigel Batiste, Group President and Chief Executive Officer of Republic Financial Holdings Limited. The Republic Group has always prioritized the holistic development of the communities and countries we serve. It's a mission driven by our flagship Power to Make a Difference corporate social responsibility program and the dedication of our staff, where we focus on 4 key pillars: the power to learn, the power to care, the power to help, and the power to succeed. For us, this is just the beginning of our sustainability journey, and we remain fully committed to unlocking financing to support the attainment of the United Nations Sustainable Development Goals, which ultimately would lead to a Caribbean region that is safe, healthy, and sustainable for many generations to come.
I am Navid Dukran, CEO of Eximbank, and we understand the power, impact, and transformative potential each citizen has. Our vision is to transform the domestic export environment and be the preferred trade finance service provider, creating value and making a difference in our national economy. Here at Eximbank, we recognize that we operate within a complex rhythm that exists in our social structures and biodiversity. It is written in every community and generation. So let us work together to facilitate growth and expansion, creating sustainable employment while respecting our planet and our environment. Our nation's strength lies in the people and the generations to come from the work we do today. The journey is before us and the challenge is here. The need is now. We are but a reflection of the world we live in. So let's work together to make it a better, healthier, and more sustainable one.
This is Caribbean Medical TV. One of the most talked about topics this season was that of dental health. We returned to Barbados and joined Dr. Alison Myers to share further perspectives and good tips when it comes to that which affects our overall health.
So gum disease is what in Barbados we used to call pyorrhea gums, what people will say getting long in the tooth. And I want to address that because in our societies, we kind of normalize things that really were not meant to be normal. So I will start by saying it isn't normal for us to necessarily get long in the tooth. Ideally, our teeth or gums should not recede and our teeth should not get shakier as we get older. But some of the signs of gum disease are those things. We may notice that we're seeing more of the root than we did beforehand. We may notice that when we touch or we try to brush our teeth, our gums might bleed. We may also notice that our teeth have changed position. So maybe in the past there wasn't a space between your teeth and now you're noticing that you have a space that you didn't have beforehand. Gingivitis is basically gum inflammation. In periodontitis, you may have started with gingivitis, but either because that bacteria has been there for too long, your body's ability to deal with it has been impaired. So for example, some patients, for example, who are diabetic are more prone to infection. Or to be fair, sometimes we have a tooth in a bad position and we're constantly getting things caught between the gum and the tooth. In each of those examples, after a while, our body overreacts. And as we overreact, we produce enzymes and toxins. And unfortunately, it's the enzymes and toxins that we produce that destroy our own bone. So we get an unzipping of the attachment below the gum line where we cannot see between the gum and the tooth. And it's a vicious cycle because as it unzips, more bacteria is able to get further down. If you brush too harshly, it can cause the gums to recede. It can also mean that you may not only brush away some of the gum, but you can actually brush away some of the root of the tooth. And that can cause little what we call abrasion cavities where the toothbrush has actually worn down the tooth, and it can cause pain because the teeth become quite sensitive. So yes, the gum recession and also wearing down the tooth can actually be quite significant if you're brushing too harshly. Water picks are actually quite helpful in trying to physically remove debris. Now this is interesting. The definition of plaque, which is the buildup on our teeth, is a buildup which cannot be removed with a water spray. So we know that water picks alone cannot cure disease, but absolutely they can help to reduce the buildup that's between the gum and the teeth. And because water is gentler, sometimes if the gums are inflamed and a little painful, using the water to help remove the debris is more comfortable for the patients. So I do advocate that persons can use water picks. I just also advise that they may also need other things along with the water pick to help really clean their root surfaces.
Many thanks, Dr. Myers. Our audiences have taken great interest in this topic as we have seen how vital dental health plays an overall role in unexpected areas such as the heart. And now another question from our audience that also looks to a much discussed topic.
There's a lot of talk around kidney and dialysis, and no one says what it all means or why the kidney is so important. Can one of the doctors share more?
Why is the kidney so important? Kidneys are exceedingly important. We take them for granted a lot. They're just two small organs somewhere in your back. That's the way most people view it. But in reality, kidneys play a very, very important role in our body. The main function that most people understand or know about is the function of getting rid of toxins. So kidneys excrete many medications and toxins via the kidneys. So the main ones that we know, creatinine, or what we call, if you look at your blood test when they've done your BUN or blood urea nitrogen, those things are excreted via the kidneys. The kidneys regulate salt and water. By regulating salt and water, kidneys participate very heavily in the regulation of blood pressure. If kidneys are damaged, they cause high blood pressure. And a patient with high blood pressure can have damaged kidneys. In fact, hypertension, as we said earlier, is the second leading cause of kidney disease, second only to diabetes globally. So there's an unholy marriage between kidney disease and hypertension. Kidney disease is certainly an emerging epidemic. Kidney disease is estimated in the next few years, 2030, I think, to be the 5th leading cause of death. And that is not an accidental statistic, if in part because the leading cause of kidney disease is diabetes. And we all know that diabetes globally is a major issue. In terms of chronic non-communicable diseases, diabetes and hypertension, of course, left untreated or inadequately treated. Because if somebody is diabetic or if living with diabetes, which is a more politically correct phrase to use now, or has hypertension, if that is controlled well, the adequate lifestyle modifications, you know your numbers, your blood pressures are well controlled, your blood sugars are well controlled, there really is no reason for that person to develop any complication of that disease, including kidney disease.
In Guyana, Dubé Medical Center was one of the first, and it is now the largest dialysis service unit. Dialysis does not discriminate. Anyone of any age, of any gender, can be affected with end-stage renal disease and likely to end up having to do dialysis. We have patients who are on dialysis from the young age of 13, and those who are approximately 84 or thereabout. Males, females, people from all walks of life, all ethnic groups, all statuses in life, professionals, common people, laborers, everyone we've seen coming here for dialysis. So there is absolutely no discrimination. But what you can do to avoid getting sick, what you can do to avoid being on dialysis, check up monthly or 6 months, you go to your doctor, follow up with your visits, adhere to diet restrictions, use your medication, and live a healthy lifestyle.
Education is key. I think if we, with programs like these, we reach people, and that is important. We absolutely have, our Caribbean people do need to understand what we need to do to prevent kidney disease. Because something that perhaps we don't speak of so much is how expensive it is to treat kidney disease, particularly late-stage kidney disease. And in the Caribbean context, we aren't exactly the richest islands in the world. We are relatively resource limited area of the world, and it is very expensive, not just for us, but for the more industrialized countries. So we need to educate people. Our Caribbean people, and I say our because we are all included, we need to understand that preventing chronic diseases, particularly diabetes and hypertension, is key to fighting this epidemic.
For this question from our audience, we traveled to our French Caribbean neighbors in Martinique.
11 ans mwen ni BPCO, se premier fois mwen katan pale di sa. Est an doktor pe pale plus a sou problem poumon? A friend has COPD, and this was the first I have ever heard of it. Can one of the doctors talk more about the lung, please?
In terms of pulmonary medicine, it's a wide range of diseases that we take care of. So the nice thing about why I chose pulmonary medicine is that it's a blend of all organ systems, because everything has to pass through the lung. So the heart diseases affect the lung. Patients who have liver diseases, because the abdomen and the liver is right underneath the lung, any diseases of the liver or the tummy would affect the lung area. In addition, conditions like rheumatoid arthritis, lupus, these things also affect the lung. And then there are the infections of the lung that people are aware of, pneumonias, viral infections, flus, that sort of thing. As a specialty, it has a wide spectrum. What happens in asthma is that people have an irritability of that airway. So they may go in a cold atmosphere, or they may be exposed to dust, or they may just have an intrinsic tendency to have an irritable airway. And what happens is that airway produces inflammation and mucus production, and then it gets tight. So they call it an airway reactivity or airway hyperresponsiveness. And it can actually be quite debilitating. And it's a real challenge in terms of getting the education out there that asthma is a chronic medical illness. Just like how if you're diabetic, you take your diabetic medication. If you have heart disease, you have to take your heart medications, watch your diet. It's the same thing with asthma. You have to take your medications. You have to adjust your lifestyle.
Let's jump back to general health. I think I usually let my patients know that I'm into quality of life. Many persons say, oh, I want to live to 100, I want to live to 105, but how will you be you at that age? Will you be able to do the things that you love to do? So I think we should really put the focus on the quality of life. Can I still continue living my why, my reason for doing what I'm doing? And that depends on my health. That means I organize my priorities in my life, and my first priority is me. Then in me, the first thing is my health. And that's the message that I think we need to push to everyone, that your health is really your responsibility. It's not the doctor's responsibility, not my mother, not my nurse, not the government, but I'm the one who needs to take responsibility for my health.
We also need to start embracing technology and meeting the people where they are. Most people live online right now. Most of the younger people, they spend more time interacting with their peers online than they do interacting with their peers in quote-unquote the physical world. So we also need to embrace that. I think oftentimes our ministries are somewhat late and archaic in terms of embracing new technology to bring information to the people where they are. And then you have all these young people with all these skills that they sit on their computers and they're amazing at. Get them, integrate them, start with them, and then disseminate it about.
As Caribbean people, I don't view myself as a Guyanese, as this, because we are, in the scheme of things, we are so small. I'm Caribbean. And I do believe we have something very special to offer. And I don't even think most of us realize the power that we have, because the outside look at us as paradise people. I would definitely say part of my growth, I have to attribute that to my spiritual growth, because growth is not accidental, it's not automatic. You have to be intentional about wanting to grow. Like, at the start of every year, sometimes we have things where we make resolution or we do our vision boards or whatever, And then when we look at the wheel of life, sometimes, of course, we look at, our finances, our relationship, our careers, our travels, whatever it is. And we look at the different areas that make up our lives. And we think, how are we going to balance this? I think we should look for that balance.
Caribbean Medical TV is truly honored to share the stories and insights of the region. These conversations on health, climate, wellness, agriculture, science, and community just echoes a part of who we are. We are all those who came before us and those to come after, and the Caribbean has been a vital keeper in our rich and diverse story. So let's be each other's keepers. As always, stay safe, stay informed, stay in good health.
I am Mia Amor Motley, and this is Caribbean Medical TV, and we can do better once we work together and change our habits individually, as families, as communities, as countries. Thank you.